Why is exercise good?
To get you strong.
Why is it good to be strong?
To get good job.
Go!
Like exercise, sleep, drink water, food, learn all types of good stuff.
To maintain a good, healthy balance, a balanced diet, and to do a daily exercise to just keep fit.
Racing, sports. Finally, you can do some things like running, like this thing where you stand on and you pull it up and down.
I think the main one is a balanced diet. Obviously peer pressure with smoking, drinking, drugs, health issues, other health issues.
Health issues, have a balanced diet, not eat too much junk or drink too much fizzy drinks.
Is it important the different types of food you eat?
Yes, it is.
What kind of foods do you think help somebody stay healthy?
Vegetables,
Yeah,
fruits,
fruit and vegetables.
fruits and
that's right.
vegetables,
What about unhealthy food? What kind of food do you think makes you unhealthy?
chocolate,
Chocolate, yeah.
sweets,
Sweets.
fizzy drinks,
What would happen if you ate lots and lots of chocolate and fizzy drinks and sweets?
drunk fizzy drinks.
Yeah.
Can make you unhealthy.
Yes.
First of all, your parents, because they know you better than almost any other person in the universe. The next set of people I'd say would be your friends and the GP, and if you need to, then the psychiatrist and psychologist that may help you.
I think the school also has a huge impact because you're there for most of the time. Being a young person, you're at school for 6 hours a day, and that's quite a lot of your time. So I think schools have, the majority of the time to tell students about your diet, about how you can stay healthy, what you can do to get you involved in different activities such as sports, to provide healthy meals, and to generally help you to keep fit and have a good health.
When I had blood infection here on my shoulder, there was bad blood, so I had to have an injection, and then I was better.
Who gave you the injection?
The doctor.
Go on then, George. Good hit. Wow.
If you were poorly or someone you knew was really poorly, would you know how to get an ambulance?
Yeah.
How would you get an ambulance?
My.
You phone 999?
Yeah.
And then what would you say?
Are you sure you're in the out?
Help.
Help.
Yeah.
And you tell them where you were,
Yeah.
and then the ambulance would come. And where would the ambulance take you?
Hospital.
Hospital, that's right. And who would you see when you were in hospital?
Doctor.
That's right, the doctor.
Should we hit it to Marcus then, yeah?
Yes.
Awesome. You ready, Marcus? Yeah. Oh, good hit. Oh, massive hit, Marcus.
If you're very poorly, do you think you'd go to the hospital?
I would do so.
You would do. And who works in the hospital? What kind of people work in hospitals?
Doctors, nurses.
Yeah, that's right.
I think the most significant thing that the staff and the GPs they need to do is smile, is make a perfect smile, because once a person smiles at you, you feel welcomed, you feel like you're going to get good support, you know, even before you meet the person, you're going to get that vast amount of support.
I think the main point there is to be respected in the same manner as adults are respected. So for the doctors to talk to you the same way as they talk to an adult, and to not use so much medical jargon, to cut down things so that you would understand it, but not to an extent where you feel as if you don't have the same respect as an adult.
If you have a very personal issue, like you're concerned you may have an STD or something, then you should be able to talk about it confidentially. And if you feel that you need to book an appointment, then you should be able to do that confidentially.
Well, a good doctor service could be where he explains quite clearly like what the issue is and how it could be resolved, and like basically like the effects of it and what you can use or what you can do to help resolve your problem.
To be a doctor, it will take a lot of intelligence and charm, being calm and not being really angry if a child doesn't do the right thing, because childs are not normally used to going to a doctor's.
There should be a campaign where like young people or maybe parents can be encouraged to grow their own vegetables and foods. You know, agriculture could be one of the answers. It's vegetarian and also it's very healthy. No, you're not growing fish and chips on the garden, but you're growing like vegetables, strawberries.
I think it's not necessarily the government's job, but it is the individual's job to whether or not to stay healthy or not. So, for instance, it's the individual who should make that decision whether he wants to be healthy.
I think they should have like the Olympics. I think they should have one for kids to motivate them to keep healthy, to stay healthy, and to have a healthier lifestyle, because they've just been watching the adults do it, and I think they would want to get more interacted with being healthy.
They should put more money into hospitals, you know, fund the hospitals. Maybe they should get more equipment, more hospital beds to meet up with the demands, and also we should try and make sure that there be more hospital staffs, you know, also to keep up with the demand.
I think the government could help give money to schools so they can ask for more people to come in to organise after-school clubs, like swimming. I think all schools should do swimming from a young age to when they're in secondary school.
More campaigns, more events to get the message across to people on how to stay healthy and why it's important to stay healthy, and also to tell young people the consequence of if you don't stay healthy, then what could happen. Because I've seen that a lot of people, if they see the consequence of something, they're more likely to stop doing something if it's bad, or to do it if it's to benefit them. So definitely more campaigns.
Okay, my name is Haytham. I am 7 years old, and I want all boys and girls to be healthy, because when you be healthy, the true thing is you can get more clever in your mind, and reading books is healthy for you too. So boys and girls, always stay healthy. And this is the end of our recording now.